Okay, so you're experiencing pain when lifting weight overhead, unable to relieve that back itch, maybe reaching forward or when throwing your bills away, and maybe even having pain while you're sleeping. Now, if you said yes to some or most of the listed symptoms, then you most likely have shoulder impingement, or also medically known subacromial pain syndrome. Well, hey, in this video, I'm going to show you how to easily fix this injury, get back to the activities you love, and how to prevent it from coming back. My name is Dr. Becca and I'm a physical therapist, and let's get into it. To start, it's also important to know the consequences for not completing rehab for this injury or completing the incorrect exercises. So shoulder impingement basically means that there is decreased space between the acromion and the rotator cuff tendons and bursa, which can cause inflammation and pain during activity or certain positions. And there are two causes for this. An extrinsic cause means that impingement injury has happened to a normal body, and these reasons could be for overuse of the shoulder, poor posture control, and trauma. An intrinsic cause means that structural changes have occurred to your shoulder anatomy, which can onset impingement. And these reasons can be rotator cuff weakness or muscle imbalances at the shoulder complex, shoulder scapular instability, degeneration with possible bone spur development, and other injuries like bicep tendonitis and frozen shoulder, which could onset impingement. So the most common consequence can be development of a serious rotator cuff injury or rupture, and then we have further degeneration, neck pain development, use of improper shoulder mechanics, and the list can go on. And to add to this, there are certain shoulder tests a physio would do in order to help rule in or out a positive sign for impingement. And such tests could be the NEAR test, the Hawkins-Kennedy, painful arc, and the Yoakum's test. So if any of these tests are painful for you, then this could probably mean that you have a shoulder impingement injury. Now you might be thinking, well, I'm positive for the impingement test, but I'm still not really sure on what to do about it. Now the first step to fixing impingement is making sure you're going to gradually return back full shoulder range of motion in all of the 6 directions. And I'm just going to be going through a couple different directions where impingement usually limits people when they have this injury. So starting with flexion, you can either start by lying on your back to avoid gravity, or using a hanging method, or using a wall for your arm to slide up on. There is no method that is considered right or wrong, it's just what works best for you, and making sure you're going to be getting back your full flexion mobility. Then if the extension direction is lost, you can use different types of objects to reach full extension. One method is going to be using a couch or a table, and the harder version is using a stick behind your back and trying to complete that full extension range against gravity. And finally, the internal rotation direction is also typically lost, and you can use multiple methods again to reach full range of motion for this. The easier version is a sleeper stretch while lying on your side with gentle pushes with the good arm, and the other is using a rope or a belt to help reach fully up behind your back again. So as your range of motion may gradually be returning, then we have to consider certain strength exercises in order to normalize the tendon and muscle tissue strength and function, and to help reduce any kind of muscle imbalances that might be present that can cause aberrant shoulder joint mechanics. So since shoulder mobility is highly dependable on shoulder blade mobility and strength, it is crucial to develop good shoulder blade strength. So we can do this first in the prone position for the rhomboids, middle, and lower trapezius muscles, and then add latissimus and serratus anterior strengthening and standing in order to add further stability to the scapula-shoulder complex. And just one tip, the weight should be challenging but not impossible to complete 8 to 12 reps, with the weight varying from something that's heavy to something that's like a can of beans. And adding to this, rotator cuff strengthening will also be important to ensure that further damage or degeneration will not occur, and will also help to improve shoulder mechanics during more functional lifts like picking up or carrying boxes. So to do this, you're going to need some sort of resistance band to complete both internal and external rotation movements, and also making sure that the resistance is challenging but not impossible, which could reduce quality of movement or allow for compensations. So to strengthen the remaining rotator cuff muscles, start with a light weight, and then we can complete 2 different types of lifts, with the focus on controlled movements and, again, avoiding any type of compensations. So pain should also be limited and not lingering after this exercise. Now, if you're somebody like me who needs a kick or a bit of a reminder about their rehab exercises to do, Yes, me, therapist, I need reminders too. I do have a printable download for all exercises shown in this video, so you can check that out in the link below. Now, I'm sure that most of you watching this don't want to get back the ability of just putting the dishes away in the cabinet, but there are things to lift and there are things to throw. In this case, we have to dial up the overhead shoulder strengthening. So returning back to our good old scapular exercises, we gradually want to work up these from the prior ones contingent on strength and pain symptoms no greater than 4 out of 10 pain, and no lingering abnormal pain symptoms after the exercise. So your rhomboids, lower and middle trapezius, and rotator cuff muscles will be challenged again. And we can complete these with resistance bands at challenging but not impossible resistances while also using control. So sometimes impingement pain will have been relieved by this point where you're starting to return back to previous sport or recreational activities, and the strengthening will usually continue for the majority of the rehab duration. So taking personal factors into account such as age, previous shoulder strength, sports, past injuries, the full rehab time can range between 4 weeks to 3 months. However, one of the biggest mistakes I see when patients are returning back to their sport or normal activities again is to never complete the exercises again. So don't do this. Impingement can return, and sometimes with vengeance, so it is best to periodically complete these exercises even if pain is not present anymore. And of course, if you like this video, please don't forget to like, comment, or subscribe to the channel so these videos can reach the same audiences. So thank you so much for taking some time with me today. I hope you have an amazing day and a better shoulder, so take care.